Good afternoon. Thank you for attending PHCA's webinar. Today's webinar is Grievance Management Best Practices. I'm Wendy Johnson with the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you can continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website later today. The webinar has been approved for 1 continuing education credit for nursing home administrators. Certificates will be emailed later today, and please note that effective April 1st, I'm required to upload the credits to the NAB registry. So hopefully you have all registered for this free service and have provided us with your unique NAB registry number. I'll be sending a link to a quick survey after later today or tomorrow. Please complete this survey, and if you're participating in a group setting, have each participant also complete the survey. Your feedback is important to us and the speaker. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. This webinar will be presented by Janine Valdez, Corporate Compliance Officer with Genesis Healthcare. The updated long-term care requirements of participation significantly change the manner in which centers must publicize and manage resident grievances. Facilities must designate a specific grievance official and ensure prompt action and documented follow-up to each grievance. This webinar will discuss the content of CFR 483.10J and the interpretive guidance for surveyors in evaluating compliance with this section, generally cited under Federal Tag 585. The presentation will also include discussion regarding best practices in grievance management. At the conclusion of this webinar, participants will be able to self-identify areas of concern that surveyors evaluate in assessing Federal Tag 585, learn effective best practices in grievance management and promotion of the grievance program, and lastly, guide center teams in providing prompt resolution to grievances. I'll now turn the webinar over to Janine.
Hi, everybody. Thank you. As mentioned, I'm Janine Valdez, the Corporate Compliance Officer of Genesis Healthcare. I appreciate everybody joining today. I come to you, from a sort of a different perspective, being that my main role is in compliance, and so I'll talk about that a little bit. I also come to you as the daughter of a long-term care resident in a facility. So, for many years I worked in the compliance department, but gained, much more of a perspective as I sort of act as both a daughter and as an overseer of our processes. The focus of a compliance program, by the way, is somewhat different, mainly, maybe from what we do on a daily basis, where our focus is to find and to correct our own issues. The grievance process is very near and dear to my heart because it's a local process that allows us to really know if we've got problems or issues of concern and allows us to correct them ourselves without the involvement of regulators or others. We come at it, with probably the best suited to correct our own issues. So as we go through, I just ask you to pay some close attention. I know this regulation came out as a part of phase 1, but we've been doing grievance management in our industry for years and years and years. And so it's crucial that we all understand that there's a distinct change and a distinct update in focus in this area, so that we're not those people that are going, I've done this for a long time, I always do it the way that I've done it. We have to sort of reduce our complacency and sort of take a new look at how we manage our grievances, and that's really what this regulation is directing us to do. So we talked about, we'll go through what 4310J says. We'll talk about what the surveyors do, other potentially related deficiencies. What I found works in the area of grievance management and promoting the program, and then, you know, maybe some tips on how to teach the team. First off, 48310 is huge, and it's the resident rights section of our regulation. And while we'll focus on J today, I would just suggest to the group that it's really important that you have a look at the interpretive guidance that came out that we gave to surveyors, as well as just the letter of the law here. It is a good idea as administrators, as directors of nursing services, and others who are involved in this process to take out the regulation and read it. And I know that doesn't sound like the most exciting way to spend your night, but it will be very, very helpful to you as you work through survey issues, not only during standard survey time, but also during complaints. Often the grievance is the genesis, for a pun there, of your complaint survey process, or of calls to the hotline, or even to litigation. So it may give you a handle on, you know, those issues if you're told about them ahead of time. So what J says to us, 48310J, is that the resident has a right to voice grievances. So it's posed a little bit differently to us than it was in the past, and that we've got to emphasize that that right comes without the fear of discrimination or reprisal. What does that mean? That means non-retaliatory. When someone comes to us with a concern, we have to be focused on that, that we won't take retaliation against the patient or the family member for voicing that concern. And that right also includes a right to prompt efforts. We don't have a definition of prompt, but it means, you know, with you know, haste here to resolve the grievance that the resident may have, and that we need to make information on how to file those grievances or complaints available. There's multiple ways we'll talk about doing that, but it has to be something that's really prevalent to the resident and the family when they're in the center. So the other portion of this is establishment of a policy. And so while this portion talks about, you know, here's all the things that your policy needs to say, it also is imposing other portions of the regulation that are new to us. So as we implement this policy, we got to think about, okay, it's not just about writing a policy, it's also about adoption and implementation and making sure that we are fulfilling all of the pieces of this. So the first is, you've got to give a copy of the grievance policy to the resident. So we notify the resident through individual mechanisms, might be your admission packet, and through postings in prominent locations throughout the facility of their right to file grievances orally, which means that you can't tell them they have to only do it in writing. They might speak the grievance to you. You might decide internally that means that someone in the center is going to assist and put it in writing. They have a right to file them anonymously, so they don't have to give you information about who is directly making the grievance. They should be provided with contact information for the grievance official, and we'll talk about the grievance official again. And that means the name of the person, the address and email, the business phone number, and when they can expect a time frame for getting something back, a right to obtain a written decision, and that to obtain means that the individual on request would get something back in writing about their grievance. And so what did I say there? I said they have a right to orally express a grievance, and then a right to request back a written decision about the grievance. And the regulation does talk about what should be included there. And then contact information of the independent parties. So on our grievance paperwork, on that notice, we would have to have the state agency contact, the QIO contact, the state survey agency contact, and the long-term care ombudsman program or other advocacy. So you can tell that this notice is going to be quite lengthy. The next portion, as we mentioned, is identification of a grievance official. So that's the person in charge who's responsible for oversight of the grievance process, receiving and tracking grievances through conclusion, leading the investigation, maintaining confidentiality as needed for those grievances. So what they're talking about there is who really needs to know about this grievance, who does not need to know, and in what format. And then issuing written grievance decisions and coordinating with state agencies depending on that type of grievance. So the grievance official is someone pretty high level within the center who's responsible for that oversight. What this allows room for is for the grievance official to delegate some of the responsibility for things like investigating. So if you think about an investigation, which is typically some component of maybe direct observation, review of documentation, it might include interviewing. The grievance official isn't designated as the interviewer, but they are able to delegate certain portions of responsibility, but they are the leader responsible for oversight. So a lot of centers are going to decide that the grievance official is going to be high level, either the director of nursing services or most often the administrator of the center, because this oversight is something that would want to be led at a pretty high level, and then delegate as needed. This also provides for that coordination with state and federal agencies. So what you might hear in your grievance process, and probably have over the years, are allegations of neglect, abuse, misappropriation, perhaps even alleged crime. And so we have to think about there is that sort of flows into the abuse management. And so they talk about coordination with state and federal agencies. That's something that you probably in your center want managed at the administrator level. As necessary, taking immediate action to prevent further potential violations. What that brings to mind for us are things, again, like abuse, neglect, misappropriation, alleged crime, significant bodily injury, and those things that require immediate action might be putting an individual on suspension or administrative leave while you investigate. What other immediate actions, you think about to prevent potential further violations might be related to other types of care plan interventions. Is it a resident to resident issue? Are there other immediate actions we want to consider? And then we want to immediately report all alleged violations as they talk about neglect, abuse, injuries of unknown source. All of these are also covered, under that 483.12 abuse rule, but we want to be constantly considering them as we're managing grievances. The next portion talks about written grievance decisions. And so as I said earlier, the resident has a right to obtain a written grievance decision. And when we think about the resident, we remember that under the resident rights, we're talking about the resident or the responsible party. They have or what they call the resident representative, they have mutual rights. So they are allowed to request written grievance decisions, and within that written grievance decision, that includes the date that the grievance was received, a summary statement of what the grievance was, what steps were taken to investigate. Again, those are often things like interview, they might be a review of the record or other types of records that the center has. They might be direct observation. And then a summary of facts, a summary of the conclusions that were made regarding the resident's concerns, a statement specifically as to whether the grievance was confirmed or not confirmed, and any corrective actions taken, and the date that the written decision was issued. So there's a lot to that. This requires you to have really a distinct form and format for your written grievance. So again, going back to the fact that the resident can submit a grievance orally, you're going to want to have a form in place and a format to make sure all of these areas are covered. Now, the focus of the grievance process is not to unsubstantiate or not confirm issues. So this is something that is a little bit different from maybe the way that you manage survey, where we're trying to look for, okay, the support for the center, that the tag is unsubstantiated. When we're talking about grievance, though, we're talking about finding the facts. And that's going to be really, really helpful to us as managers of our center, because we want to know if we have something to correct. We want to know if our issues confirmed or not confirmed based on evidence, and then make corrective action based on that. And that's going to be very, very helpful to us as we resolve issues with our patients and their families and loved ones. So that form and format is going to be very, very helpful. We do need to document that corrective action and actually take that corrective action. So we think about, okay, we had an issue, we investigated it, we determined that our staff needs additional education on a particular area. We're going to want to have that evidence of taking that educational action with our staff, because we will want to have that evidence should we have to provide it. So if there's a violation of resident rights, we're going to want to make sure that we've got that corrective action documented, and then that we've confirmed that. And then we have to keep these documents. And I know often we get questions about, well, document retention. This is not part of the legal medical record typically. So what do we have to keep? And what this law tells us is that we have to maintain evidence of the grievance and the follow-up for no less than 3 years. That's from the issuance of the grievance decision. So, for example, your resident comes to you, they have missing personal items, they want you to follow up, you investigate that issue, you might provide them with, a reimbursement of monies if they provide you with receipts, for example, and then you've decided that you've closed out your grievance with that follow-up. You have to keep your grievance document for 3 years after that decision has been made. Okay, so the intent when we think about surveyor interpretive guidance for this tag 585 is to make sure that the resident right is upheld, so that they have that right, that they know that they have that right, that there's a policy in place to process the grievance, and that we're responsible, and we know that our staff is responsible for making prompt efforts to resolve a grievance, and to keep the resident in touch along the way about how that's going, and all the while keeping it confidential as best as possible and as appropriate as possible for the issue. So we want to make sure that during the course of the prompt efforts, we know that we've acknowledged that grievance and that we're actively working towards a resolution. We're keeping the resident or the resident's representative update on our process. So when we look at the interpretive guidance of 585, so again, this is the surveyor's procedure. What they're going to do, they don't actually have a pathway. You might have heard that term before. They don't have one of those survey pathways where it's a question and answer process on a document. They just talk about, okay, this is how we would investigate this area. So the first thing that I'm sure that you've seen in your new survey process or heard about, if you haven't gone through a survey yet, is heavy reliance on interviews. Okay, so the surveyors are coming in now and spending quite a bit of time on the floor talking to your residents and patients, and they're also spending quite a bit of time on the floor talking to your staff. And so what they say is, if as you're talking to the resident, the response indicates that they have problems voicing grievance, they don't know the grievance process, they have never been told what it is, or they tell you, I've said 5 times now that my laundry hasn't been clean, or I don't have clothing and no one's done anything, that's going to trigger the surveyor to ask some more questions. So if a resident's response indicates problems in voicing a grievance or failure to resolve, they're going to take some next steps. They're going to ask for permission to review the resident council minutes, and they're going to look in there and see, okay, have there been grievances voiced that are not resolved? Have others come to resident council and said, we've voiced things and they haven't been resolved? They're going to interview staff about how grievances are handled. So it's important the staff know the procedure, and they're going to ask questions about how does the staff protect our resident from discrimination or retaliation as a grievance is voiced. So you want to make sure your staff is aware of that their response might be, we've been educated that we can't ask a resident about their particular, concern if we're not, if we're not supposed to be aware of that. Or we might say that, we've been strictly educated to never ever approach a resident in a derogatory way about voicing a concern. We know that we are not able to retaliate or against a resident in any form, and that we never threaten or coerce a resident. We don't approach a resident directly if they've made a comment about my personal care and services. Those might be some of the comments back from the staff. How does the staff ensure that the right to file a grievance anonymously? I talk to my folks about this a lot, because sometimes there's a concern that, oh, since something was voiced anonymously, it might be, construed as not as valid. It's important to note that, as a daughter of a patient, at times I'm concerned that I might go to the staff and they might be upset that I've said something and might take it out on my mom, who is, who's got compromised health. And so there is a concern on the part of our family members, perhaps, that there might be retaliation against their family member, and there might be a valid, reason why they don't want to voice a name. So it's important for us as operators to just be vigilant about that and understand that there might be a concern, and let the individual know that, yeah, while it's an anonymous concern, we are going to follow up. If the issues with call lights, we are going to still look into it and do some direct observation of that. We are going to ask our other residents or a grouping or sample of residents about their experience. And our whole goal there is to see if we've got an issue that requires correction. And so how do we ensure the rights of residents that file a grievance anonymously? We really don't care so much about trying to find out who the reporter is. We care about the issue that they're raising and if there's something to correct there. They also might interview staff about the communication with residents regarding the process. So how do you make sure that Mrs. Jones knows that you're following up? And it might be that our practice in this center is within 24 hours of getting that grievance, at the maximum, we're going to make sure that that resident knows we've received it. And then perhaps your process is every day or every 2 days, we're going back to that resident until resolution and let them know, okay, here's Mrs. Jones, what I did today about this. If the individual comes to us anonymously, we might say, we're not going to reveal your name to the staff, but here's what we personally have done to follow up. So what the surveyor then is going to do is review the grievance policy. And what they're going to do is go right back to this language where it says the facility must establish a policy, and they're going to tick through all the things that need to be in there. So again, it's really important for you to take this regulation, take your form, take your policy, and make sure that it meets all of those criteria. So then they're going to take a few moments and determine how you let the residents know about the grievance process. So they might say, we want to see your admission kit. We want to see the postings within the center. We want to know how you promoted this to your resident. And then they're going to take a look at those written documents that we've composed, and they're going to review those decisions and make sure that if the residents had requested the information, that they've gotten what they requested. And we're maintaining that for 3 years. So we're going to look back. Right now, their look back period is going to be the date of the requirement of participation, which was the 2016 deadline. They're going to say, up to that date, do you have everything available? And then over the course as the years flow, they're going to be looking for 3 years of evidence. So important to note all of those areas we want to look at. So to cite deficient practice at 585, this is important. The surveyor's investigation shows that the facility failed to do one or more of the following. So support the right to voice a grievance. That means, is it posted? Did we follow up? Was there discrimination? Was there non-retaliation? Do we fail to make prompt efforts to resolve? And did we make information available? So it's extremely important that we understand this criteria because this is the criteria you would use if you were trying to IDR a tag in this area. You'd want to look and say, no, we did support this. Maybe we have evidence that the survey team, didn't recognize. Important to note, though, that there's a lot to this regulation. So what you're wanting to do is make sure, again, that that policy includes all of these notifications that are required, that it identifies the grievance official, that we've taken steps to prevent any further violations as we're working through, that we're doing immediate reporting where necessary, that we've got written grievance decisions, that we're taking our corrective action, and we've got that evidence maintained. Of course, we can always see those cross tags or other areas where you're going to want to take a look. And so if we fail to allow a resident to exercise their right, including that anonymous portion, they might look at a cross tag at 550, resident rights and dignity. If they fail to report, remember that huge new rule about failing to report within 2 hours. If we've got abuse, and 24 for other issues, we've got to look at F609 and make sure that we've reported well, so we could see a tag in that area as well. So what I recommend to folks as we're looking at these tags at 585, 550, and 609, make sure that if you're doing a pre-survey process in preparation for your standard survey or as a course of action, if you're vigilant about those complaint surveys or self-reports coming in, you're going to want to make sure your pre-survey is updated to cover this, because this is new. In years past, we weren't required to issue written decisions on request. Now we are. So we want to make sure that our pre-survey processes test for these things, that we're out and about doing interviews of our residents, that we're out and about interviewing our staff to make sure that they understand the process that we follow. So getting into some grievance management best practices. Again, I said, we've managed grievances in our industry for a long, long time. What we want to do, though, is take another look, a refresh look at the way we manage grievances in light of this regulation, but also because it's really a good thing for us to do as operators. This process, making sure that this is a really good process, helps us in a lot of areas outside of just the small, grievance and concern compliance. So what we want to do first is think about this in the area of prevention. Before the complaint occurs, what can we do to make sure we've got good customer service and management? We might be able to do some things before this ever becomes a formal grievance, right? So first things we think about in the area of prevention as we think about operating our center is, okay, we have a code of conduct. We have a standard of the way we operate our building. And that's not necessarily just something that maybe corporate, companies that are chains have, but everyone should have a standard that we all live by that sets the expectations of our staff. Here in our center, we provide excellent customer service, excellent care to everyone, and that's the code that we follow. So we want to make sure that that's really well ingrained as we have individuals come in providing care. It doesn't only apply to, our employees, it applies to staff that are coming in. We want to make sure everyone understands when we walk through our doors that we have a standard of high level of care and services. We might look at it as a background screening and hiring as a prevention area as well. Before the grievance occurs, I want to make sure that I've got good people providing care and services. So I'm going to scrutinize who I hire. I'm going to scrutinize what's in their background. And if we see weaknesses, we're going to spend some extra time during orientation with those individuals, or perhaps not hire them. And then as we're bringing people on board, we want to make sure that we're educating them, and that's effectively. So when we're thinking about folks that we hire individuals that come in and they've just gotten their CNA certification. We're hiring nurses that are new grads, that are new to long-term care. We're hiring in some places people with high levels of experience into roles. But what we want to do in our centers is make sure that we are effectively educating to these things like code of conduct, to customer service being number one, and affording our staff the time to provide that customer service is huge. So it's getting those individuals that deal with our patients and families in front of people who really do provide good customer service. Those are the individuals you want training people when they're coming in the door. And then constantly going over that theme of non-retaliation. That's a long word, non-retaliation. So I talk about it in local sense. Non-retaliation means not taking something away from someone or treating them differently because they said that they had a problem with the care or services that you gave. And that comes with a certain level of responsibility, but also a certain level of maturity. So it's something that as administrators and directors of nursing and leaders in our building, we really have to train to, that we have a professionalism that comes with, hey, if someone says something about my care and services, yeah, that might hurt my feelings, but it's not something that I'm going to take back out on that resident or that family member. If I've got a concern about that, I can talk to my supervisor, someone in management, but I'm not going to take it back out on the family because they've already got compromised health and other issues that they're dealing with. And so I don't talk about retaliation maybe with that word, but I talk about what it is in action in the building. It means not treating someone differently, not taking something away or making them feel badly because they said something was wrong. Ultimately, we've got to be open to that kind of feedback. And so the other thing that we always recommend is this open door policy. So what does that mean? It means that our staff and families need to be absolutely comfortable coming to us, that they have to get that feeling like we want to know if there's something wrong during your stay. We want to know if there's something wrong during the employment, right? And so that open door policy is something that's hard to get energetic about every day, but something we have to be energetic about every day. And then we've got those customer service approaches that are hugely important in our world, ambassador programs, setting someone up with a person that's going to check in with them on a regular basis and ask, how's it going? And want to know the answer, both good and bad. Most of the time, what we hear when we run those ambassador programs is we see a decline in grievances because the person's coming to us directly and saying, I couldn't figure out where mom's laundry is today. Can you help me with that? That doesn't mean we have to get into a big formal grievance process if we're able to work it out right then and there. So it's that just-in-time approach. And finding the right ambassador for the right person sometimes takes us some time. But ultimately, it pays out tenfold if we're able to follow up, and not get into a protracted investigation process. So then another great practice is promotion of this program. And some people shy away from this. They say, you know what, if I promote this, I'm going to hear grievances. But that's the whole goal, really, in a compliance program is knowing what's going on that's wrong. So promoting that through posters, forms, notices in the admission materials, a posting in the center that's prevalent that says, here's how you tell us what your concern is. If you want to do it anonymously, here's a secure box that you might put it in that we check a few times a day. We might have supplemental postings. One that I really like is one that has maybe the picture of the administrator, the picture of the director of nursing, the picture maybe of the social worker that has their contact information on it. That photo really helps because then it's recognizable. I can go up to that person and say, here's my issue. You might designate, the grievance official might designate a person for that sign. Another really good practice is that manager on duty posting. I walk in, I see at the front desk, today the manager on duty is Judy. So I know that I'm supposed to go to Judy if I have an issue. And that's very helpful on the weekend. That's very helpful at night to know who that manager on duty is. Another really important piece of that is making sure the staff know who the manager on duty is. So when someone's calling or coming in, they're aware. Okay, tonight I know as the CNA that Judy is the manager on duty and we can bring concerns to her. We might have a welcome binder in the residence room that talks about lots of different things, including if you've got any concern at all, here's who you go to, here's your ambassador. We might meet and greet newly admitted residents. That's all part of setting expectations. Do we know who our patients are? Do they know who we are, right? And then promotion during the stay. Do we do regular listening sessions for our patients and their staff? Do we do regular education for those folks? We're offering, different sessions on perhaps, Alzheimer's or memory loss, or things that we do to make sure the laundry isn't lost, whatever those are, engaging our patients and their families. Do we do interviews during the stay? So this is one that I talk about frequently, because we have survey teams, and the first thing they're going to do is start interviewing residents. How often do we do that effectively? Do we want to hear what they've got to say? Do we do presentations where we're asking for permission to go to resident council and then talk about the things that are coming up and how we're addressing them? And then documenting in our notes how they are addressed. Do we do things like staff appreciation? That might sound like an odd one during a grievance discussion, but one thing that I've encountered over the years is that staff appreciation comes very, very close in being very, very helpful with appreciation of our residents. When your staff feel appreciated, they want to continue doing a good job, and they want to do that for your residents and families. One of the things that struck me really recently, I went on a trip, and in coming back, I noticed a really great example of proactive customer service that I wanted to share. So, we all know that there's lots of industries out there that deal with customers, and my example relates to taking a flight recently on Southwest Airlines. So while that doesn't sound anything long-term care related, I came away from the experience in a really positive place, and that's what we want our residents and families to do. Southwest Airlines and many others probably have this thing called proactive customer service. So the other night I'm flying home from a trip, and we experienced extreme weather, can't take off for several hours actually, and then have to deplane and get on a different plane. During the course of that flight, we had a mechanical issue. So you can imagine how long this day was for the travelers on this flight. The reality was that Southwest Airlines had nothing to do with the weather, and they really can't control this mechanical issue that happened to be the plane hitting a bird and breaking the windshield. Now, why I bring this up is because they didn't have any control over any of that, but it really was a hard experience for the riders on the plane, because we had to deplane twice. We didn't get, it was a 10-hour trip that should have been a 2-hour trip. The next morning, we all were issued an email from the airline apologizing, while out of their control, apologizing for the experience. And so what that made everybody feel like is a little bit better about the situation. Out of our control maybe, but something that we really care, and we noticed that maybe you didn't get the level of service that you wanted. And so I just asked folks on the line to sort of think about that proactiveness, that going to the person before they even voice a concern and saying, I think something might have gone wrong. How can we help? Does that mean, that we have to give them something? No, but is it just that going to individual and saying, look, here, we care about your experience. We think you might have experienced some delay or some issue. We want to figure out how that doesn't happen again, and showing that we care. We talk about this top 5 residents and families. Those are the people that are the hardest to deal with, seeking out those challenging residents and families. And that's a really hard one, right? Who wants to go to a family we know is going to complain and ask them how things are going? Ultimately, though, I found over the years, this is very, very helpful. Identifying your top 5, maybe there's 6, maybe there's 3 residents and families who are the hardest ones, and trying to resolve through their issues the best that we can. We've got to bring our grievances to our morning meetings. If we're morning stand up, stand down is one of the best processes that our industry has come up with. And we got to stay really, really in touch with our grievances during that process. That's a great way for the administrator, director of nursing, to be very, very aware of the feedback. So we want to celebrate at discharge. We even might consider exit interviewing of our residents. How did it go? Is there something that we could have done differently or better to make this a good experience for you? So identification at grievance official, to me, a best practice is that is the center administrator. Delegating that to another management level, to me, creates some challenges, because we as the administrators want to be the one communicating with external agencies and making sure that the process is flowing the way we want to. That person maintains confidentiality. Taking those immediate actions as necessary is huge. Do we need to put the individual on leave or suspension? Is there a way to quickly resolve those issues? Keeping touch. I would say the number one thing that we see when we see breakdown in these areas is a failure to communicate. The patient went to someone, maybe we took even the actions that were expected, but we didn't communicate back to the family or to the patient, so they don't really know. And that piece of it is when we're going to see follow-up issues. Maintaining a good grievance log and maintaining those files is huge, because that's an easy tag, right? If I don't have 3 years of grievance look back in my documents, that's an easy tag for a surveyor to give. And then we've got to train and retrain. This is an area where we're constantly talking to our staff about customer service. So what I think of as really best practices in this area as well are making sure that we're open to the concern. I talk a lot about not assuming. Often this can be, one of the biggest issues I see is we think we know the answer before we've done the process of looking into the issue. I've already taken in that grievance and I already have made my decision about what happened. Not a good place to go. What we generally want to do is, rather than say, yeah, I don't think the call lights I think there was no issue with the call lights. We want to go back and see, do we have a call light system that will tell us more about how long that call light is on? Oh, well, that doesn't tell us anything. It looks like the call lights were answered within 2 minutes. Well, then we want to dig deeper. Did the CNA come in and turn off the light and leave without performing the care and services? So we want to do more investigative process rather than less. And I'm sure a lot of you have heard, the assume metaphor in the past. We want to not assume something. We want to teach others not to assume. We want to focus not on unsubstantiating the issue, but really being open to seeing if we've got an issue. There are also those areas where we can respond directly in the moment. I can't find my mom's pink pajamas. Can you help me with that? Handing someone a grievance form right away might not be the best approach. It might be, okay, let's try to figure that out before we go through the grievance process. We want to think about notification of concerns. So do we have a routine process in place to inform the grievance official or the designee if there are issues? What's that routine process look like? Hopefully it's not, our routine process is that we slide a note under the administrator's door and then they follow up when they step on the note in the morning. It's something that's routine and regular communication, stand up, stand down during the day, immediacy, what does that look like? We want to make sure that there's a lead investigator on these issues. So not just an oversight person, but someone who's got the expertise to go in, and maybe they have to do a few things. Maybe they have to do interviews. Maybe they got to look at some documents or do some direct observations in order to determine what the facts are. So it's not necessarily quick. Quick isn't, well, prompt is the word, right? Prompt is, as quickly as possible to get to the facts. So there is this sense of urgency as well as due process. Communication's key with the complainant, with the management, and then evaluating the effect that could take place on other residents. Remember, we always think about that when we're thinking about these processes. If this is happening with Mrs. Jones, could it also be happening on the other floors? Could it also be happening throughout this area of the center? We take the results of this to our QA, PI, or to our quality assurance performance improvement process. We take our log, we take our grievance forms in, and we see, we have themes, because I know over time, if we're dealing with quite a few grievances, we might need to take them in and sort of digest them again at the QA, PI level. The other thing that we want to do as grievance officials is make sure that we're not being overly proud if we've got nothing in our grievance log. Often I've gone into centers for pre-survey or other processes, and I'll say, can I see the grievance log? And they'll say, oh, we haven't had any. How likely is it during the course of dealing with patients in a 100-bed center that you have no grievances during the time periods? It would be very, very unusual, and it means, to me, it sort of triggers there might be a breakdown in process. So it's not always a good thing if you're saying, oh, there's nothing in my grievance log. That means that you haven't maybe taken the opportunity to analyze and to correct issues. What does it do if you have a strong grievance program? What does it do for you? So we're thinking about, if I've got a good grievance program, I'm not going to see 585 or one of the other tags that we talked about. The reality is that what you're going to see with a good grievance program, including the mechanisms that I talked about, the promotion, the ambassador program, when you see a good, strong grievance program in a building, what you are going to see is a reduction in external interventions. What are those things? Okay, you might see a reduction in calls to your company's hotline if you have such a thing, or calls to the survey agency, because the issues are being resolved internally. You've got proactive customer service going on. You might see a reduction in other types of regulatory intervention. So those complaint surveys that come in. You might see a reduction in general and professional liability claims and litigation, which are scary words, right? But if you have a proactive, I'm asking you, I'm documenting the response about how things are going, I'm going to see a reduction in claims and litigation because I've taken the opportunity to correct myself. We also get that evidence of due process, which is hugely important in our world. We want to have evidence of the steps that we've taken to make the stay a good stay, both from a patient care and service perspective and from those other issues, environmental or otherwise. The increases our internal identification of deficiencies, which is our own way of managing our concerns, right? And then we promote quality care and customer service. And what that helps us with is down the road, you know, we're in a stage right now where, gosh, you know, every admission is important. So promoting the quality of care and service that we provide is going to allow us to see our customer base improve. It's going to allow for more admissions to our center if individuals have a really good stay and good experience with this process. So I'm going to leave it there and open it up for questions about anything that I've mentioned, or you know, questions about the regulation as we've reviewed today.
Thank you, Janine, for the information today. At this time, we'll open up for question and answer portion. So please submit your questions using the box on the right hand of your screen. We already have one question that's come in, which I'll read to you. Please clarify. Is the written response to a grievance required only when requested?
That is a great question, and the question I've probably gotten most often next to, you know, who should be the grievance official. The law says that and I'll read it again so that everybody's clear, that the resident has a right to obtain a written response. I'm just going back to read this in detail. So this is under 48310J number 4. When you talk about policy and how the policy must be written, it says that the policy include information on the right to obtain a written decision regarding his or her grievance. So that word to obtain, if you look it up in the dictionary, means that there's some action on the part of the individual seeking the information. So my interpretation of that is that it is on request, a written decision. Now, that request again could be orally or in writing, so you want to be clear about your own internal process. But that is one that you can take up with the surveyor if they try to cite you. I would cite that language. It is a right to obtain a written grievance.
Okay, next question. Is there something in the regulation about the appropriate time frame for response? Example, 48 to 72 hours.
No, there isn't. What the language says is prompt resolution. So many of your grievance might hold to that 48 to 72 hour rule. Centers, I know centers and companies have made decisions about what prompt means in their worlds. The regulation says prompt, but I would, you know, take care with that, because if your resolution is taking more than that, you know, 48, 72 hours seems kind of appropriate time frame, you might have to defend the reasons why it took as long as it did. Maybe you had to do more comprehensive interviewing. Maybe you had to do some observation of an individual who was not on site during those days. So there should be a reason if you're outside of a a normal immediacy, because the regulation does talk about prompt a few times. That includes facilities' acknowledgement of a complaint and grievance and actively working towards resolution of that grievance. So again, that 48 to 72 is what I hear often as a policy, because we don't want to get outside of that and have to defend our efforts outside of that time frame.
Okay, great. There's a couple questions around whether or not we'll be sending out the PowerPoint, and yes, we will. I'll send that. It'll be made available in the follow-up email that I send later. All right, are there any other questions? We'll give it about another minute or so and see if any come in.
Okay, well, I'll just mention that I have gotten, over the course since the ROP came out, questions about designation of a grievance official. Some, administrators thinking, well, I can delegate that whole responsibility to someone in the center. And while that's true under the rule, it says that, they just say you have to designate a grievance official. The reality is that that's a really, really hard thing for a center leader to delegate to someone else, because as you read that language, it talks about, maintaining the communication with state agencies and about the oversight that's involved. And when you think about your license and you think about your role, I would have a hard time delegating that to someone else in the center. So just a word of caution as you're thinking about, delegating all the responsibility associated with that title.
Okay, we have another question. Are hotline calls to be processed as grievances? What if they come in anonymously?
That is a great question, and one that I think a lot of centers and companies have had to grapple with. While the rule doesn't say that you have to treat hotline calls as grievances, I can tell you our organization has said, if this concern that you're receiving lends itself to the grievance process, then you should document it in your log and follow up as if it were received as a grievance. So it's going to vary perhaps depending on the content of that call. And even if they are anonymous, they might lend themselves to the grievance process. As you've heard, you can file grievances anonymously. So what really I say to folks is look at the concern itself. Does that seem like it's something that would fall in the area that you would normally treat as a grievance? If so, you're going to want to log it in and treat it as a grievance.
Okay, any other questions? Okay, I'm not seeing any. Again, a survey is going to be mailed later today or tomorrow, along with a recording of today's webinar and the PowerPoint presentation, along with Janine's contact information. So if you do think of any questions that you have, you can contact her directly. Please take a moment to complete the survey, and I want to thank Janine again for presenting on this topic today. It was great information and important, and just want to wish everybody a good rest of your day and rest of your week.
Okay, thank you. Call or email me if you have questions.